This is Tiffany Robinson, Training Specialist for ComForCare Franchise Systems, and welcome to the ComForConnections Podcast. In this Masterclass episode, Strategies for Aging Pros, Staff Competency, and Caring for the Older Adult, I am joined by Susan LaGrange, Pathway Health's Chief Nursing Officer. Listen to this Masterclass episode as we delve into the latest strategies and best practices for enhancing and measuring competencies that ensure better care of older adults and quality outcomes. Whether you're a professional caregiver or healthcare professional, this webinar offers valuable insights and practical tips for enhancing the quality of care provided to older adults.
So providing a solid system of ongoing education and verification of competencies will be essential for quality, client or patient satisfaction, as well as caregiver success. So upon hire and on a regular basis, leaders will want to be sure that all caregivers are educated and competent in the services that we provide to our customers. So today, we are going to discuss some user-friendly strategies for creating a process for employee verification of competency with care and services. So today, more than ever before, we have seen across the country volumes of new employees that are working in settings that may be new to them. And then you couple that with all of the new expectations over the past several years from regulators on both state and federal basis. We are finding ourselves that we know we have systems that we need to make sure are current and updated to meet that best practice approach, because that really is what the regulators and our customers are expecting. And healthcare organizations have so much on their plate today, and competency is one area that is really so important for the quality of care for the services that you provide to your clients. So we are going to walk on an education journey today, so to speak, and that starts with identifying the unique patient population that we care for, keeping in mind that this may change over time, right? Which then leads to our needed KSAs, also known as knowledge, skills, and abilities that will be required by your staff, which then will lead to that determination of the competencies that will be required at the various levels of caregivers that provide care in your organization to be able to meet those needs of your patient population. Next, this will lead you to be able to develop your training plan and your competencies. And then after all of that is done, you will want an evaluation method. So I want to backtrack a bit and discuss KSAs for just a minute. So when we look at the K, which is knowledge, that will focus on whether your staff have an understanding of the concepts, the subjects, the topics, the items of information that they should know at the time of employment, as well as refreshers annually or as determined necessary when you have new residents, new equipment, new disease state processes that you need to be training staff on. And then next is the S, which is skills. And skills are those capabilities or proficiencies that will be developed through training and even sometimes hands-on experience. And those skills will need to be measurable and observable. And then lastly, when we talk about the A, which is the abilities, that will include the traits or talents that a person will bring to their role or facility on the job position. So we're going to discuss some of the elements of competencies moving forward today. So strategic initiatives and priorities is one of the elements of competencies, and that really looks at the type or types of services that you are planning to continue, add, or even explore in your organization. One of the other elements of competencies will be the marketplace trends initiative, because just about all settings have seen an increase in the acuity of care, right? that is required in the patients, residents, or clients that you have admitted to your service or organization. And then, of course, there are those regulatory requirements, which is another element of competency, which looks at those requirements for training and competencies. And many of you are aware that they have been enhanced in the past 8 years. And then also looking at workforce trends, current and future needs, because we have to keep up with the growing needs for employees. As think about it, those baby boomers are needing care, and that is outpacing the caregivers that are available to provide that care. And then also we have to look at the training program staff and deployment based on needs, because it's going to be important that we really take and tailor our training based on the needs of our customer. And then, of course, we all, depending on your setting, have organization-specific training program and objectives. Now, keep in mind, we're also going to need to be aware of things such as local culture, also respect shown to our consumers, and beliefs about what our customers value in the care that's provided. We also should talk with our staff about the history and reputation of our organization in the community. We also want to be discussing the availability of continuum of care. So these are all going to be important. And then many times too, we need to include those human resource competencies with our staff as well. So let's talk a little bit about definitions. And the competency definitions, when we're looking at CMS, which is the Centers for Medicare and Medicaid Services, they look at a measurable path, skills, abilities, behaviors, and other characteristics that an individual needs to perform work roles or occupational functions successfully. And CMS also says that all nursing staff must also meet the specific competency requirements as part of license and certification requirements defined under state law or regulation. Now, certainly not all settings are CMS certified, right? But this is a great definition because it also looks at things that competency is known for, such as we have to have a measurable pattern, and it needs to align with the work roles of each individual employee in your organization, because at the end of the day, we need to meet that resident population needs of our customer. And for any long-term care participants that are on this call, if you're looking at the nursing facilities, the competency also needs to align with the facility assessment. I want you to take a look at the link on the screen because you will be receiving this in your handouts. And there is a PowerPoint training on Miller's Pyramid on clinical competency that can also help you as an organization with assessment of your team needs, which really takes a look at knows, which is your knowledge, knows how, which is your competence, does, which is the action, and then also shows how, which is the performance. And this is a great framework for clinical assessment that Miller has put together that can help you when you're looking at working with your team on competency. So certainly when we're looking at the overall goals of competency and training with our staff, the first would be we want to be able to evaluate the ability of our staff. And that includes looking at our existing staff, but it also includes new staff. And if we're using any contract or agency staff that we work with, because we as leaders want to be confident that our team is qualified and competent to be able to care for our patient population. And since this is a fluid process, it must also be then looking at the next goal, ongoing, meaning that education and competency evaluation cannot be a one and done scenario. Our patient population changes and the skills needs can change. Also, equipment that we need to use can change. Assessment needs can change. Even basic care needs, right, of our patient population can change. Therefore, A system that is ongoing will be essential for quality. And next, a goal on preventing negative outcomes. And that is by providing quality, well-planned approach to education and competency will be essential, which will then lead to the overwhelming goal of provision of quality care. Now, keep in mind, this also includes planning for what our patients, clients, or residents consider what they believe is quality care. And this is why it is going to be important and so crucial in your planning and communicating is really looking at the individualized needs of your patient population, because that's going to be so important in the process. So let's take a look at some of the required training and competency topics that are so important. Preventing and reporting abuse, neglect, and exploitation. And this is for all settings, because this will be instrumental to make sure that our new employees, ongoing employees, and contract or agency staff really have a good understanding of our abuse, neglect, and exploitation policy and procedure. Also, dementia management, because in most of the settings that are here today, listening to this webinar, dementia management is really a required training or competency, and that will include the types of dementia, the assessment process, also looking at management and individualized care needs, looking at approach. So these are medication management. These are all areas that we will want to take a look at some of the required training. And then, of course, infection prevention and control. And as we know, infection control is an area that is so important, and that can be from the basics, such as hand hygiene, right, to more intense stressing changes, outbreak management, PPE, personal protective equipment use, and so much more. I could talk on infection prevention and control for 8 hours. Also looking at competencies related to approved nurse aid training and evaluation program for those of you that have certified nurse aides working in your setting. Also, medication management, specific for the settings in which medication administration and management is being used. Also, change in condition. And in some settings, this is a required competency. Resident or patient rights, that's a required. Also, care, which will be important because we want to make sure that we are looking is important with their care and their care planning process. Communication is another area that is a required training. Basic nursing skills, ADL care, activities of daily living, then basic restorative services such as range of motion, walking or ambulation, mouth care, foot care, nail care. Also in many settings, skin and wound care, and that can range from prevention to treatment. And then pain management, which could range from identification, assessment process, to managing pain. Cultural competency, behaviors, how to identify, planning for care, how to approach a resident, how to respond, what to report, how to manage, as well as trauma-informed care, which is the TIC. So I had mentioned the change of condition for all staff, because all staff will need to be aware of your protocol for identification and communication of a resident with early acute change of condition in order for the nurse to evaluate. And in settings where a nurse is not available, or in settings where a nurse is not working, really providing approaches to prevent decline or hospitalization whenever necessary. So maybe asking yourself, what are you using? One evidence-based process is the Interact Quality Improvement Program, which is interventions to reduce acute care transfers. And what Interact is, it's an quality improvement program designed to improve the identification, evaluation, and communication about changes in resident or patient status. And it was first designed in a project supported by CMS, or the Centers for Medicare and Medicaid Services. And now many post-acute care providers across the U.S. are using Interact. And the overall goal of the Interact program, which again is a quality improvement program, is to reduce the frequency of transfers to the acute care hospital, because those transfers can be emotionally and physically difficult and can result in numerous complications of hospitalizations, as well as being very costly. And Interact can be used. There are different sets of tools and resources for nursing facilities, for assisted living, and for home health. So let's take a look at our organization training program. And we want to make sure that our training needs are met for new staff, existing staff, also our agency or contract staff, as well as for volunteers. So this is a great time to evaluate your organization's training program, and that includes your onboarding of new staff, as well as how are you onboarding your agency staff? What do you do for your annual training? How do you develop and deliver new and necessary updates to training based on your patient care needs? And is your program for employees consistent with their expected job roles and job descriptions? You may need to look at what policies are required, and always ask yourself, do they meet professional standards of practice? So let's take a look at the process. So step one will be to look at your patient population, because this is where you can plan, deliver, and assess your competency based on your organization's needs that are dependent on the population that you serve. Let's start with the facility or organization assessment. So it's a great idea to complete an organization assessment. And for those of you attending today that work in nursing facilities, the new updated facility assessment requirements require us to inform staffing decisions to ensure that there are sufficient number of staff with the appropriate competencies and skill sets necessary to care for its residents' needs identified through the resident assessments and plans of care, right? So we also want to look at our patient and organization needs when we're looking at our process. Do we look at our standardized assessments so that we can pull out the identified needs for training and competency? Do we have specialty programs that would require additional training and competency validation? Also taking a look at confidential feedback reports, satisfaction surveys. What are our customers saying about our quality of care that we provide and our competency needs? Because this way then we can plan our education looking at our data. Also, your individualized needs in order to make education to your staff both meaningful to them as well as to meet the needs of your residents. So then let's look at step two, which would be looking at those KSA, those knowledge, skills, and ability needs of our staff. So if we look at our knowledge, which is focusing on our understanding of the concepts, our skills, which is our capabilities and proficiencies, and then our abilities, which is our traits and talents, because this then will require you as an organization to review your patient population, to look at your clinical systems, look at your technology, look at your resources, look at the standards of practice to develop the competency requirements that you have for your licensed and non-licensed staff. Because fundamentally, your organization will want to identify the patient or resident's needs to determine, beyond the required topics, what KSAs, behaviors, and other characteristics are going to be needed to plan for your education. And also, don't forget the importance of documenting evidence of the entire process. And what that means is identify your assessment of what your needs are, identify your training, and identify the competencies in the documentation. So we will need to assess the capabilities and competencies depending on your settings, because once again, this will vary. So you will need to determine that process to assess, and then determine the roles and responsibilities of your staff members, any licensure and certification requirements, and then align with those. Assess your current status, your disease state competencies that will be necessary. And then for those of you that have a medical director or a medical advisor, you're going to want to coordinate and include input and then assess the status with any mandatory competencies, any technology, and then making sure we have the right people in the right role. So we want to take a look at all the different employees that work with us and also the input that we can to develop our training program. So that will be any nursing staff, any frontline caregivers, interdisciplinary team, non-direct care staff, leadership, any governing body, or anyone. And then we want to also add our residents and resident representatives, because it is important that we include all in looking at what topics and what needs do we have in our programs. And then we want to identify any gaps. So we want to take a look at any gaps in our current education and competency validation. And so we want to take a look at our data, determine individual and organizational root cause. Also, KPI, which is our key performance indicators, will look at our organization and individual evaluations. We want to look at employee assessments. We want to look at, are we going to include observations? What are we doing right now? So that when we're looking at our programs, if we have any gaps with our orientation, our annual or ongoing education, we're going to want to take a look at how can we fix those areas. And then step 3, we want to determine our organization competencies that will be essential to meet the needs of our unique patient population. So there we put it all together where we identify the gaps, we determine those competencies that are needed for all staff at all levels. We want to prioritize which competencies are going to be important for the needs of our staff to meet the needs of our resident. And then we will be able to develop that education and evaluate that education. So some of our provider considerations, and this would be for all settings that are here today, we want to take a look at our local culture so that we can meet the needs of our resident population. Also beliefs at what our consumers, our customers, our patients, our families, our residents, what do they value in the care that's being provided? We had talked a little bit earlier about the history and reputation in the community. If there are opportunities for improvement in this area, then this could be an area that we look at. So if customer service is one of those areas, then that may be an area that we may want to add in our education. Also, we want to take a look at the education, competencies, and skills of our current staff, and then evaluate our training program for staff and volunteers. We want to also bring in human resource types of areas that we want to address, and then take a look at compliance, ethics, and HIPAA for privacy concerns, because we know that privacy is so important today that we don't want to forget that training with all of our staff when we're training in all of those areas. And then for long-term care facilities, for nursing facilities, we also want to look at facility assessment consideration and also taking a look at any type of hospital or insurance contracts or partners on that help us with the type of residents that we will be taking in to those facilities. Some of the basic care clinical considerations we will want to include in our training will include infection control, as we talked about earlier. Also, incontinence management, and depending on your setting, knowledge of individualized toileting programs, as well as the assessment process will be so important. Taking a look at weight, nutrition, and this is also looking at dietary concerns where we can bring in some of that cultural competency involved in that training as well. Looking at mood and behaviors. And this is also looking at approach following the plans of care, the ISP, the directions given, looking at pharmacological as well as non-pharmacological approaches to care and documentation when it comes to mood and behaviors. Also, depending on the types of care that is being provided and your setting, device use. What types of devices are you using for your patients, clients, or residents? And have all staff been trained based on the manufacturer's instructions on the use of those devices? Also, psychotropic medications and medication reconciliation, depending on the settings. But these are also some of the basic considerations when it comes to training and competency. And then there are additional clinical considerations that we would want to cover. And those will include for responsibilities for the licensed nurse, such as an RN or LPN or LVN, really looking at those clinical areas, change of condition, which we had talked about, treatments, whether it's wound care treatments, whether it's IV treatments, dialysis, in the settings that those are provided, and making sure that the staff are educated and competent to provide those services. We talked about infection prevention and control, but even getting into transmission-based precautions and really taking a look at making sure staff are following those infection prevention and control requirements, cultural competence, and making sure we're looking at training all staff in those individualized person-centered care plans, and then trauma-informed care as well. We also want to take a look at any medications, fall prevention measures, and following the care plan, pressure injuries, specialty programs, rehab programs. Also, it's important for all staff, but also for the nurse, looking at patient and resident rights with care, and even what happens if they refuse care. Are we giving those patients or residents an opportunity to make an informed decision? So really training them in talking about explaining why it's important that they provide the services. And if they refuse, letting them know the risks and benefits and document that you've provided that resident or patient with that informed decision-making. And then, of course, abuse prevention is so important for all areas. And depending on the setting that you work in, there may be even additional skills necessary, such as head-to-toe assessment skills, care plan or ISP development, neurological evaluation, even looking at cardiovascular, respiratory, musculoskeletal, or other GI types of assessment, looking at sleep patterns, or even oral or dental assessment, and then, of course, even that documentation. Additional clinical considerations in your training can include, again, person-centered care, communication, and that communication would be inside and outside of the facility, looking at within all of the interdisciplinary team, but also to your clinicians, to the hospitals, and also to any other transition of care entities, restorative nursing, and then pain management. Some additional clinical considerations for all post-acute care providers would include aligning that training with your population to look at the acuity and the types of care you're providing, your demographics. And again, I had mentioned the continuum or partner expectations so that all staff understand what those expectations are and the marketplace needs and expectations. Many times when U.S. facilities are seeing that higher acuity type of care that you're providing in your setting, explaining to the staff about the marketplace needs and the expectations. And then for anyone in your entity that will be in a leadership or supervisory role, we're going to want to also make sure we have good training in leadership and supervisory skills as well. So we should really base our competencies on job descriptions, right? Because that's important that we really take a look at that. And each job category will need to have their unique set of competencies to be able to do their job. So it's important to really take a look at a good needs assessment based on your facility needs, your resident population, any skills that are necessary for care. And when you're looking at that, it's important that we look at the scope of practice of each individual that is working in your facility. And then again, making sure that we take a look at what do the staff feel their needs are. And so it's important when we roll this all out that we also take a look at our policies, our procedures, and even taking a look at what is our evaluation and follow-up. So let's take a look, first of all, about a needs assessment from our staff. So if we take a look, we can have them answer the basic questions. What is your competency need? What is the priority? What are some action steps then that we can put into place? And so it's important to take a look at the competency needs in the job categories, followed by a needs assessment by the staff, asking staff, what would I feel I need more training on? Because it's important that we don't just rely on one individual within an organization deciding what types of training needs to be put into place. Using a team approach to evaluate from the staff that are actually providing the skills and determine the competency and training needs for the facility is so important because we want to engage team members into the process so it's meaningful and it can provide leaders with additional insight so that you have successful outcomes when it comes to your training process. So then next is a training plan and competencies. So if you take a look at the components, once again, we have individualized plan, right? Based on your organization plan, should be for all staff. We want to make sure it's organization specific with skills checklist. We talked about that to include mandatory training, specialty training, organizational training, and then identified needs based on any gaps that you identify. And that competency training will be based on orientation, your current training program. You pull in those gaps, you outline your need, and then you set an agenda. So your agenda should outline your objectives and a tracking system and the type of modalities. And remember, for long-term care facilities, you want to align this with your facility assessment. So your curriculum will need to be objective, not subjective, to determine why the education is needed. You want to involve the department leaders based upon the plan. And we need to consider that the adult learning needs and multi-generational needs of our staff need to be considered when we're developing the curriculum, and we can utilize some of the subject matter experts we have in-house to assist with that curriculum development, which will pull in all the areas, regulations, best practice approach, our facility or organization needs, our policies, procedures, our patient needs, and then our staff needs, and roll those all together to develop a training plan. So that training plan, you're going to want to put in place what you're training, what your objectives are, and how you're going to actually deliver this. So it's important for you as a facility to develop and write a good training plan for each of the areas you plan on training of your staff. And then the next is determining the modalities. How will education be delivered? And many of you are already doing this. You're looking at in-person, some of you have web-based, a conference, a skills fair, some are lecture, some you have in more of a TED type talk format, podcast, some are doing video messaging. So again, some have games, right? That gamification, role-playing, and even case studies. So there are so many different modalities that you can use, and I would recommend to change it up, because if people are sitting in front of a screen for just a video type of training, are they actually making sense, or are they looking at their phones and not paying attention? because whatever education we're providing, we want them to be interested. We want them to be getting out the information so that they can deliver the care we expect them to provide. And next, we want to evaluate our training. So it's important that we have a training program evaluation summary that really takes a look at, are we looking at a good process to evaluate what process we're training our staff? And then upon completion, the facility is responsible then for adherence to the training objectives. And that training needs to then result into them providing the practice we expect. And there are various methods that facilities can choose to verify and validate training objectives and facility practice. And that can include, again, a lecture with a return demonstration. You can have a post-test. You can have a skills demonstration, return demonstration. You can observe them. You can do a self-assessment, a simulation, preceptor, or even peer-to-peer if staff are interested in working together. And then some type of competency evaluation. And this is an example of a licensed nurse and CNA competency checklist for basic nursing. And you can use whatever works for you, but you will want to have a solid system to validate the information that you're training so you know that they are competent to provide the care. And then for all education, you want to make sure that they are attending, that they sign in for compliance, that you have documentation of your training sessions, you have a curriculum with a calendar, that you have competency verification, that you have post-training review, and so observation. And it's important then that you have all of this information, right? And that you include the effectiveness and the evaluation and roll that through your QAPI or your quality improvement program. Next is your evaluation method, because it's important that you have a good evaluation program. And this will be required to determine the effectiveness of your training program. And so does it meet your training objectives, whether it's the individual's response, your trainer's effectiveness, or even the training effectiveness, right? And do they have changed behaviors and improved outcomes? And is your overall training program reviewed annually or as needed? And do you have documentation to substantiate that? So Tiffany is going to provide us with some excellent examples.
Thank you. Example of a training plan in action. In the example I want to share today, we are looking at a home care agency providing supplemental staffing for an assisted living facility. This particular facility houses a large population of clients who are bedbound. The community wanted to make sure that each and every caregiver entering the building had training on caring for a bedridden client. To meet this need, we looked into our library of courses in our learning management system and found a well-rounded curriculum of courses to help each caregiver have a basic knowledge walking into the community to provide care. This included courses on making an occupied bed, shampooing hair in bed, giving a bed bath, using a bedpan, preventing pressure injuries, and using a sit-to-stand lift. The training was provided virtually at the caregiver's pace, requiring that the coursework be completed prior to working in the facility. In addition to the online coursework, we also had our nurse manager provide pop-in visits to ensure caregivers were providing adequate care and that the caregivers felt comfortable in the care that they were providing. If a caregiver had questions or needed guidance, we would provide them with on-the-job support by having our nurse manager or lead caregiver show them proper techniques and skills and having them show the skills learned in a teach-back program. We also regularly asked our caregivers, clients and their family, and the building management for feedback. One thing we recognized was that many of the residents at this facility were newer. Many were also newer to having a loss of mobility. Many were experiencing stress and depression as a result of not only losing mobility, but also losing their perceived independence by not living on their own. We realized right away that we needed to add training and a mindfulness program to address this need. We added training from our learning management system for our caregivers on client depression and stress to help them learn more strategies to help the clients have productive and valuable days. We also provided a workshop for the families. Many family members did not know how to address their family members' depression or feelings on their recent move and on the recent changes to their health and mobility. Our goal was to educate the family members on how depression can be a symptom of changes in health and mobility, and especially in recent moves and relocation. Helping the families understand the experience of their loved ones was valuable and beneficial for our program overall. In this example, our training was provided to our staff via our learning management system, while our family workshop was provided as an in-person training. We verified our staff training by performing competency assessments and provided on-the-job support for those who needed additional support. A long-term program has aided this location in having a long-term relationship with the community and providing supplemental staffing. This office has now had a 5+ year relationship with this assisted living facility and credits their commitment to training as a reason for this ongoing relationship. Utilizing different training methods. The biggest part of a training program should be that the program is tailored to the needs of the caregivers and their clients. Different training methods you might utilize are instructor-led. So this is in-person. Think of traditional in-person training. E-learning. Do not be afraid of venturing into the virtual world. E-learning can have huge benefits for your team. It allows training to be provided at the caregiver's fingertips. It can be available to them 24 hours a day. You can also add benefits such as gamification to your training, which adds small gaming elements to your training, which can encourage engagement and motivate caregivers with friendly competition. Blended learning. This takes the in-person training and the virtual training and puts them together, presenting some topics in person while allowing other topics to be covered in a virtual element. Coaching. This allows a more personalized approach to training with a one-on-one focus. Role-playing. This allows your team to practice skills on one another in a low-stress environment. Job shadowing. This allows your team to see a more skilled or experienced staff member perform the skills and learn from seeing the skills performed in person. These are only some of the many methods that you can use in your training. I recommend that you try different methods and challenge yourself to find the best fit for your team. Maintaining training success for the long term. Assess the training needs of your organization. Think about what needs to be provided initially as well as ongoing. Training should always be reevaluated over time to make sure that it still meets your needs. Always be ready to update your training as needed. I like to look at training programs every 6 months once they are put into place to simply evaluate their effectiveness. It does not mean changes will need to be made, but we should be ready and willing to adjust as needed. Set clear objectives. Have a clear set of goals and needs. Evaluate effectiveness. Are we providing top quality care? Are we regularly missing something? Be mindful of how the team is doing. Gather feedback. Survey your staff. Is the training meeting our needs? How could the training be better? What is it missing? What do we spend too much time on? Train your trainers. Training is always evolving, and trainers must be lifelong learners. We need to stay on top of new findings and methods. What is new in our industry? Take time as a trainer to attend conferences and stay on top of studies and new findings. And finally, always plan ahead. It is always easier to plan training than to quickly react to an urgent need. Try to anticipate the needs of your organization. always by paying attention to what's going on.
Thank you so much, Tiffany. Those were excellent strategies. Really appreciate that great information. So we're going to end today by talking about some key strategies for leaders on how do we start. So let's start with that needs assessment for our team, because we're going to use clinical as an example. And if you develop a needs assessment, you can look at communication system, right? For changes of condition, for example, or basic care needs for all employees, or assessment skills for the nurses. Think about it. There are times when, as the acuity has changed, we have some staff members in our organization that have worked with us and they're very good employees for many years, but we may need to work on some of their skills with the enhanced, increased acuity of the type of care that is expected in today's, looking at knowledge of disease states. What about pharmacology knowledge for nurses with all of the new medications that are out there today? Also, comprehensive person-centered care planning, which is different than individualized care planning. And it's really making sure that we have that person-centered approach. We talked about communication, documentation, also, and I don't want to skimp over documentation because it is so essential today that our staff have a good understanding and education on what the expectations are for documentation to show evidence of the care they provide. And then, of course, anything else that's based on your unique organization needs. We want to engage all players when it comes to our staff and our partners. So we can look at any medical advisor or medical director that we have working with us, any practitioners, acute care partners, pharmacy consultant, even looking at lab or radiology, home care, assisted living, hospice entities, nursing facilities. And I want to just stop here by talking about the importance of including everyone. Think about if you have new residents with a new disease state that you want to involve either a nurse practitioner or a medical director to come and provide some of that education. Or if your organization is seeing more residents or patients with behavioral health need, maybe even working with behavioral health specialists and including your pharmacy consultant or a pharmacist to come in and providing some of that education because they are the expert and they can help you with developing that process. So it's important that we really work with our experts that we are partners with to help us with developing some of our education. And then also taking a look at developing our systems, making sure that when we update our policies and procedures that we're providing education with the staff, because if we update those policies and procedures and we don't educate the staff, then they don't have an understanding of what's expected of them, looking at new forms or electronic health records, or if we have a new process, we want to make sure that we're including staff education, any patient or family education, and then, again, that evaluation and follow-up. And don't forget the regulatory and evidence-based materials. When those are updated, we need to update our process as well. Tiffany, some tips for training leaders' success.
Yes, tips for training leaders' success. Be a lifelong learner. I'm going to mention it again here. Have a commitment to development and improvement. Be open to learning. Sometimes as a person who has been in a role or an industry for many years, we sometimes feel like we know it all. We have to be open to what we don't know yet. Be adaptable. If one method isn't working, try something else. Be open to different learning styles and methods. We have to be open to new ideas. We also have to be open to technology as it evolves and offers us new solutions for training. Respect your audience. I love training as much as the next trainer, but we cannot disrespect our audience by giving them too much information or training and not respecting their time. What is the right amount? What are we required to provide? And then what is the amount that clearly provides the information in a digestible way? We also have to look at the needs of our audience and their challenges. If you have staff members struggling with the way you are providing training, consider offering a separate training session for those struggling. Do they need a job shadowing session? Do they need some coaching through a particular skill? Be an effective communicator. Use clear language to build rapport with your team. Encourage continuous learning. Express excitement when your team finishes training. Consider offering a small token of appreciation when training is completed on time or if optional training is completed. And finally, do not be afraid to repeat training. Sometimes we need to see the content annually. Reminders on skills can always be helpful. All right, Sue.
Thank you, Tiffany. Those were great tips for success. So Benjamin Franklin says, tell me and I forget, teach me and I may remember, involve me and I will learn. And it is so important when we're looking at developing that training plan to really involve the staff that we're working in that training program, because they will be able to assist you in that needs assessment, also to be able to determine what's working, what's not working. And it's important that we get their buy-in, because then the training will make sense to them. And we want to make sure that they are using the updated information and training for quality outcomes for the patient, client, resident that you're taking care of. And so I want to thank you today for attending this presentation, because we covered so many different areas very quickly. And I just want to also one more time talk about the importance of documentation of our training process, because we can provide the education and the training to our new staff, our existing staff, and for our agency or contract staff, as well as volunteers. But if we don't have a system to be able to substantiate evidence that we've provided that training and that they are competent in those areas, then we could fall into where regulators take a look at the training and indicate that we don't have the documentation to substantiate our training was provided or the competency. So it's important that we have the entire process when we're looking at our systems.
Listeners, visit ComForConnections.com to download complimentary resources, view show notes, and access our episodes. You can also subscribe to our podcast on your favorite app. Thank you for listening and helping older adults live their best life possible.